World Health Organization to estimate the magnitude of this worldwide pandemic. A plan was put in place and stakeholders began executing their roles in protecting the public health. In the fall of 2005, in response to the government's lessons from combating avian flu, Congress provided $6.1 billion in the 2006 supplemental appropriations for pandemic planning across several federal departments and agencies. Since then, annual funding has been provided to the Centers for Disease Control and the FDA, and activities in Health and Human Services to continue work on vaccine development, stockpiling of countermeasures, and assistance to states. In late April of this year, Margaret Chan, the World Health Organization's Director General, declared, quote, "A public health emergency of international concern when the first cases of the H1N1 virus were reported in the United States. National and state plans were in place and orders for vaccines were processed. Among other actions, officials released antiviral drugs from the national stockpile, developed and released diagnostic tests for the H1N1 virus, and developed guidance for the clinical management of patients and the management of community and school outbreaks. The administration requested $9 billion in emergency supplemental appropriations to address the situation. On June 26, the President signed an appropriations bill which provided $1.9 billion immediately and an additional $5.8 billion contingent upon a presidential request documenting the need for and proposed use of the additional funds. In total, from 2004 through 2009, Health and Human Services alone has received almost $9 billion for pandemic flu preparedness. And again, this doesn't account for the other billions to other agencies. However, for the $9 billion and counting the government has spent on preparing for a pandemic outbreak, Americans have only experienced frustration at vaccine shortages and the long lines for the limited supply of H1N1 vaccines that are available. This should make all Americans extremely nervous about the government possibility taking control of our healthcare system. 3 months ago, we were told, this is important, 3 months ago, we were told that the CDC expected 120 to 160 million doses by the end of October. 2 months ago, the administration's estimate of vaccine availability dropped to 40 million by mid-October, with 20 million additional doses rolling out every week. Last week, the estimate dropped again. Now, only about 28 million doses are expected to be available by the end of October. Yet the CDC estimates that there are at least 45 million high-risk Americans, including pregnant women and children in need of the vaccine. So according to my math, we're about 20 million doses short. Unfortunately, the outbreak of the flu is widespread and deaths are accumulating. The Washington Post reported yesterday, quote, as of October 17, 46 states were reporting, quote, widespread influenza activity, and many doctors' offices have been swamped with swine flu patients. The U.S. government has ordered enough vaccine to make up to 251 million doses if needed, but production has been slower than originally anticipated. A total of 11.3 million doses of vaccine had been shipped to U.S. doctors, hospitals, and clinics as of Wednesday, according to the CDC, out of a total of 14.1 million doses that manufacturers had shipped to warehouses by that time. By Friday, 16.1 million doses of vaccine had been shipped to warehouses. In Arizona, state officials estimated a need of 900,000 to 1 million vaccines for my state's 6.5 million residents.
The senator's time has expired.
I ask unanimous consent for 2 additional minutes.
Without objection.
However, Arizona has only received 263,000 vaccines as of yesterday. The swine flu vaccine was only available at 35 of the 113 planned clinics in Maricopa County. The article quoted the county's director of public health as stating, It's a very frustrating situation where we are just not getting what we need. Right now is completely out of everyone's control. On October 24th, the Arizona Republic reported the lines were long, but the desire intense Saturday as hundreds, possibly thousands of people waited up to 3 hours to get in one of today's rarest experiences, a swine flu shot. The doses available represented a little more than 1% of Maricopa County's population. People were turned away if they did not fall into the high-risk group. Mr. President, Congress needs to know more information. Obviously, the hearing we had in the Homeland Security Committee last week was at best misleading as to the magnitude of this problem, and we need more information from the government, and we need to act now, find out how we're going to get enough swine flu vaccine to take care of the citizens of this country, and we've already invested $9 billion. I don't think we've got a lot to show for it. Mr. President, I yield the floor.
Mr. President.
The senator from Oklahoma.